Last month, I received a call that broke my heart. Mrs. Margaret Thompson, a 73-year-old retired teacher from Austin, Texas, had fallen in her own bathroom and fractured her hip. What seemed like a simple slip turned into 6 months of recovery, loss of independence, and a cascade of complications that could have been prevented. The devastating part? Her bone density test 3 years prior had shown early warning signs, but she didn't know that 2 specific minerals could have changed everything. If you're over 60, what I'm about to share could be the difference between maintaining your independence or facing a similar fate. My name is Dr. Emily Hartman, and I've spent over 15 years as a geriatric physician specializing in preventive care and metabolic bone health. Throughout my career, I've witnessed countless seniors lose their quality of life due to something entirely preventable: muscle weakness and bone deterioration. Today, I'm going to reveal why 2 minerals are absolutely critical after 60, and more importantly, how most people are getting this completely wrong. Before we dive in, if you haven't subscribed yet, I strongly recommend hitting that subscribe button and turning on notifications so you never miss another health tip designed specifically for you. If you find this video helpful, please leave your questions and video suggestions in the comments below. I read every single one, and it helps me create more content to help people just like you. Now, let me tell you about Mr. Robert Chen, a 68-year-old architect from San Diego. Robert had always been active, playing tennis twice a week and walking his golden retriever every morning. He considered himself healthy, took no medications, and prided himself on his independence. But over 18 months, he noticed something troubling. Getting up from his favorite armchair became harder. His tennis serve weakened. Climbing the stairs to his home office left him winded. He attributed it to normal aging, something everyone told him was inevitable. Then came the day that changed everything. While reaching for a book on a high shelf, Robert felt a sharp pain in his shoulder. At the emergency room, the X-ray revealed not just a rotator cuff injury, but something far more concerning. His bone density was critically low, and his muscle mass had decreased by nearly 20% compared to 5 years earlier. The doctor's words hit him like a truck. "Mr. Chen, your bones are fragile and your muscles are wasting away. We need to act now before something worse happens." What Robert didn't know, and what most people over 60 don't realize, is that 2 minerals work together like partners in a dance. When one is missing, the other cannot perform its job properly. These minerals are calcium and magnesium, and their relationship is far more complex and crucial than most people understand. Let's start with calcium, because everyone thinks they know about calcium. You drink milk, you're fine, right? Wrong. After 60, your body undergoes dramatic changes in how it absorbs and uses calcium. Your stomach produces less acid, which is essential for calcium absorption. Your kidneys become less efficient at activating vitamin D, which helps calcium get into your bones. Your intestines develop resistance to calcium absorption. It's like trying to fill a bucket with a hole in the bottom. No matter how much you pour in, you're losing more than you're gaining. But here's what shocked me early in my career. I had a patient, Mrs. Linda Foster, a 71-year-old former nurse from Portland, who was taking calcium supplements religiously. She followed every guideline, drank fortified milk, ate cheese, took her supplements with meals, yet her bone density continued to decline. Her muscles grew weaker. She developed persistent muscle cramps that kept her awake at night. When we ran comprehensive blood work, the answer became clear. Her magnesium levels were dangerously low. Linda's story taught me something crucial that changed how I practice medicine. Calcium without adequate magnesium is like having a key without a lock. Magnesium is the mineral that actually helps calcium get deposited into your bones. Without enough magnesium, calcium can end up in the wrong places, in your arteries, your kidneys, your soft tissues, causing problems instead of solving them. Even worse, magnesium is required for over 300 biochemical reactions in your body, including muscle function, nerve transmission, and energy production. If you're still watching and finding this information valuable, comment minerals below to show you're with me. I want to make sure this reaches as many people as possible. Now, why does this matter so much after 60? Let me explain the biological reality that most doctors don't take time to discuss with their patients. As we age, our muscles naturally begin to deteriorate in a process called sarcopenia. Between age 60 and 80, the average person loses up to 40% of their muscle mass. This isn't just about looking weaker, it's about function, balance, independence, and survival. Your muscles need magnesium to contract and relax properly. They need calcium for the electrical signals that tell them when to move. When both minerals are deficient, your muscles can't generate force effectively. You become unsteady. Your reaction time slows. Your grip strength weakens. Simple activities like opening a jar, carrying groceries, or catching yourself from a fall become increasingly difficult. Let me tell you about Mr. James Patterson, a 75-year-old retired firefighter from Chicago. James had spent his career carrying people out of burning buildings, climbing ladders, breaking down doors. He was proud of his strength and vitality, but after retirement he gradually became less active. His diet consisted mainly of convenient processed foods, sandwiches, canned soups, frozen dinners. He didn't think much about nutrition because he'd never had to before. Over 3 years, James noticed his balance deteriorating. He'd stumble over nothing. His handshake, once firm and confident, became weak. His daughter noticed he was shuffling his feet when he walked. One winter evening, James slipped on a patch of ice in his driveway. The fall resulted in a spinal compression fracture. During his hospital stay, the medical team discovered his magnesium levels were so low he was at risk for cardiac arrhythmias. His calcium intake was moderate, but without magnesium, none of it was doing its job. James told me something I'll never forget. He said, "Doctor, I saved lives for 30 years. I never thought I'd end up unable to save myself from a simple fall." His voice cracked with emotion, and I knew I had to help more people understand this before it was too late. The relationship between calcium and magnesium is what I call the mineral partnership. Think of calcium as the building material for your bones and the signal sender for your muscles. Magnesium is the construction worker that puts the building material where it belongs and the conductor that ensures all signals are sent and received properly. You need both in the right balance, typically a ratio of 2 parts calcium to 1 part magnesium. But here's where it gets tricky, and this is information that could literally save your life. Most people over 60 are getting too much calcium from supplements and fortified foods while being dangerously deficient in magnesium. This imbalance creates a cascade of problems. Excess calcium without sufficient magnesium can lead to arterial calcification, increasing your risk of heart disease and stroke. It can cause kidney stones. It can lead to constipation and digestive issues. Meanwhile, the magnesium deficiency means your muscles are cramping, your bones aren't strengthening, your energy is depleted, and your heart rhythm can become unstable. Mrs. Sarah Williams, a 69-year-old librarian from Nashville, came to see me with complaints of severe leg cramps, fatigue, and anxiety. She'd been to 3 different doctors who couldn't find anything wrong. Her blood calcium was normal. Her vitamin D was adequate. But when I checked her magnesium levels, specifically the red blood cell magnesium, which is more accurate than standard blood tests, she was severely deficient. Sarah had been taking calcium supplements for osteoporosis prevention, but nobody had told her about magnesium. Within 6 weeks of correcting her magnesium deficiency through diet and supplementation, Sarah's leg cramps disappeared. Her energy returned. Her anxiety diminished. But most importantly, her next bone density scan showed improvement for the first time in 5 years. She told me, "I feel like I have my life back. I can walk without fear, sleep without pain, and enjoy time with my grandchildren." If this is resonating with you and you're learning something new, leave a like on this video. It helps me reach more people who need this information. So what are the best sources of these crucial minerals? For calcium, you want to think beyond dairy. While milk and cheese are good sources, many seniors have difficulty digesting lactose. Better options include leafy green vegetables like kale and collard greens, sardines and salmon with bones, fortified plant milks, tofu made with calcium sulfate, and almonds. The key is variety and consistency. For magnesium, this is where most people fall short because modern diets are notoriously low in this mineral. The best sources are pumpkin seeds, which are magnesium powerhouses, dark leafy greens like spinach and Swiss chard, black beans and legumes, whole grains like brown rice and quinoa, dark chocolate with at least 70% cocoa, avocados, and fatty fish like mackerel and salmon. But here's the reality I need you to understand. Even with a perfect diet, most people over 60 cannot get enough of these minerals from food alone to reverse existing deficiencies and meet the increased demands of aging. This is where strategic supplementation becomes important. Mr. David Martinez, an 82-year-old retired postal worker from Miami, resisted supplementation for years. He believed he could get everything from food. He was eating reasonably well, yogurt for breakfast, salads for lunch, fish twice a week. But his bone density continued to decline, and he developed a persistent tremor in his hands. After much discussion, he agreed to comprehensive mineral testing. His calcium was low normal, but his magnesium was critically deficient. His potassium was also low, which further impaired his muscle function. We created a targeted supplementation plan for David. Calcium citrate, which is better absorbed in older adults with lower stomach acid. Magnesium glycinate, which is gentle on digestion and highly absorbable. Vitamin D3 to help calcium absorption. And vitamin K2, which helps direct calcium into bones rather than arteries. Within 4 months, David's tremor improved significantly. His grip strength increased by 30%. His balance tests showed remarkable improvement. At his recent checkup, he told me he feels stronger at 82 than he did at 75. Now, let me address something critical that many people don't consider. Medications can severely deplete these minerals. Proton pump inhibitors for acid reflux, which millions of seniors take daily, dramatically reduce calcium and magnesium absorption. Diuretics for blood pressure can deplete magnesium, potassium, and calcium. Corticosteroids accelerate bone loss. Certain diabetes medications affect mineral balance. If you're taking any medications, you need to have this conversation with your healthcare provider. Mrs. Helen Rodriguez, a 70-year-old retired accountant from Phoenix, had been on a proton pump inhibitor for 15 years for chronic heartburn. She developed severe osteoporosis and muscle weakness despite taking calcium supplements. When we investigated, we discovered the medication was preventing her from absorbing the very nutrients she was taking to protect her bones. We worked with her gastroenterologist to wean her off the medication using alternative strategies and added magnesium supplementation. Her improvement over the next year was nothing short of remarkable. The question I get asked most often is this: Dr. Hartman, how much should I be taking? While I cannot prescribe specific doses for individual viewers, I can share general guidelines that you should discuss with your own healthcare provider. Most seniors need between 1,000 to 1,200 milligrams of calcium daily from all sources, food and supplements combined. For magnesium, most need between 300 to 400 milligrams daily, again from all sources. But timing matters tremendously. Taking large doses of calcium all at once reduces absorption. Splitting doses throughout the day is far more effective. Calcium and magnesium can compete for absorption, so some experts recommend taking them at different times. Magnesium is often better taken in the evening because it can promote relaxation and better sleep. Calcium citrate can be taken with or without food, while calcium carbonate needs to be taken with meals for proper absorption. Let me share one more story that brings this all together. Mrs. Patricia Anderson, a 65-year-old yoga instructor from Denver, prided herself on healthy living. She exercised regularly, ate organic foods, practiced meditation. Yet she was shocked when a routine bone density scan revealed osteopenia, the precursor to osteoporosis. She came to me frustrated and confused. "Doctor, I do everything right. How is this possible?" We discovered Patricia was consuming very little calcium-rich food because she was lactose intolerant and didn't like many vegetables. Her magnesium intake was also insufficient despite her healthy diet. Moreover, her intense exercise routine without adequate mineral support was actually depleting her reserves faster. We created a comprehensive plan that included calcium and magnesium supplementation, dietary adjustments, and modified exercise routines that included more resistance training. 1 year later, Patricia's bone density had improved, and she'd gained muscle mass at an age when most people are losing it. She told me, "I thought healthy living was just about exercise and organic food. I never realized these two minerals were the foundation everything else was built on. Now I'm not just practicing yoga, I'm teaching it with confidence, knowing my bones and muscles are strong enough to support me for decades to come." Here's what I need you to understand as we wrap up. Your muscles and bones are not separate systems. They work together in an intricate dance that depends on proper mineral nutrition. Strong muscles protect your bones from fractures. Strong bones provide the framework for muscle attachment and function. Both require adequate calcium and magnesium to function optimally. After 60, your body's ability to absorb, utilize, and retain these minerals declines significantly. This isn't inevitable aging, it's preventable mineral deficiency. The consequences of ignoring this information are severe. Hip fractures in seniors lead to loss of independence in over 50% of cases. Muscle weakness is the #1 predictor of falls, disability, and mortality in older adults. But the good news, the message I want you to walk away with today, is that it's never too late to take action. I've seen patients in their 80s regain strength and stability they thought was gone forever. So, what should you do right now? First, have an honest conversation with your healthcare provider about your calcium and magnesium status. Request comprehensive testing, not just standard blood work. Second, evaluate your diet critically. Are you consuming enough mineral-rich whole foods? Third, consider whether your medications might be depleting these crucial nutrients. Fourth, if supplementation is appropriate for you, choose high-quality, absorbable forms and take them correctly. Fifth, combine proper nutrition with resistance exercise, which is crucial for maintaining muscle and bone strength. Remember Robert, the architect who could barely climb stairs? He's now back playing tennis 3 times a week. Linda, the former nurse with relentless muscle cramps? She sleeps peacefully through the night. James, the retired firefighter? He's volunteering as a mentor for young firefighters, standing tall and strong. These transformations didn't happen by accident. They happened because these individuals took control of their mineral nutrition and gave their bodies what they desperately needed. Your bones and muscles are the foundation of your independence, your quality of life, and your ability to do the things you love. Don't wait until a fracture or a fall forces you to pay attention. The decisions you make today about these 2 essential minerals will determine whether you spend your later years active and independent or struggling with preventable disability. If you found this information valuable, please share this video with someone you care about who's over 60. Leave your questions in the comments. I read everyone and try to respond as often as possible. And most importantly, schedule that appointment with your healthcare provider to discuss your individual mineral needs. Your future self will thank you for taking action today. Stay strong, stay healthy, and remember that aging is inevitable, but deterioration is optional.